The chair and president of Access Health International, William Haseltine, joins us now from New York. First, I'd like to get your thoughts on Chinese President Xi Jinping's call for more equitable distribution of vaccines and then his commitment of $3 billion in international COVID aid. How does that all help?
That helps enormously for much of the world. This is a pandemic, which means it's all over the world. We know that every day about 800,000 people are infected. That's a really big pandemic going on. In some parts, as you pointed out, of the world, it's declining. In other parts, it's still rising. As long as anybody in the world is suffering from this disease, we're all at risk because this virus changes. Our vaccines may protect us now. We don't know for how long. And we're not sure they're going to protect us against the next variant that comes up. So it's really important for everybody in the world to work together.
So
the amount of money and vaccines that are necessary to confront this problem is truly enormous. It's great that the rich countries of the world have the resources to help those without, both by providing money, by providing vaccines, and I think most importantly, by providing the technology that allows them to make their own medicines and their own vaccines. It's really important to transfer the technology. You know, the old adage, you can give people a fish or teach them how to fish. Much better that every region of the world has the capacity to make a wide range of vaccines they need to protect themselves from this and from future pandemics.
And Dr. Haseltine, I wanted you to expand on that because one of the major issues discussed in Rome, but also leading up to this, is relaxing vaccine patents, getting the World Trade Organization involved, and then separately increasing production in Africa. So speak to that a little bit, because you talk about making it available, having each country have the capacity and the materials to make their own vaccines.
Right, that's absolutely critical, not only for this pandemic, for other epidemics. And now we have a whole new class of vaccines, mRNA. The technology is very limited. It's time to diffuse that technology. But when it comes to patent waivers, I think there's a lot of things we can do. One, we can gift vaccines. Two, we can give people money to buy vaccines. Three, we can help people make their own vaccines. Four, there are a lot of discounted, at least 5 different levels of discount. Let me give you one example for hepatitis C drugs. In the US, those drugs cost $80,000 for a treatment. In Europe, about $30,000. But companies can provide those for $3,000 for mid-income countries, $1,000 for low-income countries, and through the TRIPS agreement that already exists for $35 if they're not paying any patent royalties. So we have the systems in place without patent waivers to do this. And I think those are the systems we should favor. I especially, as I mentioned earlier, favor world banks, the World Bank and other international banks funding vaccine infrastructure in different parts of the world, Africa, the Middle East, many other places where we really need this kind of infrastructure to make their own vaccines.
We're running out of time, but I got to ask you about this meeting. One of the big points about this meeting was discussing ways to make sure that the countries can handle the next global pandemic. Are you confident that they can do that? Do you think that they learned some valuable lessons from the COVID pandemic?
You know, I'm a pretty big skeptic on that front because I was involved with the HIV pandemic that's still going on, and we gave exactly the kind of warnings you're getting today, and the world just forgot. SARS scared people temporarily, and we forgot even to do research on coronaviruses. So although it's really important, I think we have to keep insisting that we don't want this to happen again. We have a recent memory that this kills people and it kills economies. And when you kill an economy, you affect every single person in a nation, every single person on the globe. So we should do it. Whether we will do it, I think all of us have to do our part to make sure our countries step up to the demands that we're going to have and that the world coordinates in a way we haven't done before. Am I optimistic? Not very, but I think we've got to be persistent.
All right, Dr. William Haseltine, thank you so much for joining us from New York.
You're welcome. Thank you.